Dr. Curcio, I can't believe I'm finished with reconstruction. It's been a year since you first diagnosed me with stage 0. And I'm so thankful because it's non-invasive. Am I unusual to have stage 0?
Well, currently, over 20 to 25% of breast cancer patients are stage 0 at the time of diagnosis. And that is for the most part because of screening mammograms and ultrasounds that detect breast cancers before we can actually feel them.
And if you think about it, I started with mammograms late 30s. Had them every year, and somehow I knew that would save my life, and I feel so thankful. But all the different techniques that I had to go through, we did the core biopsy, you did the lumpectomy, we did the bilateral mastectomy, and then breast reconstruction. I told you right from the start, I was very afraid of doing anything but a bilateral because of what's happening in Washington with what's going to happen with Medicare. I'm 64.
Well, Linda, you're a poster child for why screening mammogram and using selective ultrasound is so important for our high-risk patients. You come to us with a family history, you had extremely dense breasts. Use the modalities we have at our fingertips to help diagnose you at the earliest stage possible. Stage 0 has a 98 to 99% survival rate. But because we had options for you, we were able to use mammogram and ultrasound and MRI to diagnose you. We found your cancer so very early. And your case is a perfect example of why screening does work for our patients.
Well, what if I came at a later stage and I go into Medicare and they pass a government-run health care? What happens? Would I get the kind of treatment that I would need, pills or whatever I'd need?
Well, that's a great question because Medicare currently doesn't provide for drug coverage, and a lot of the anti-hormonal therapies that we use for breast cancer treatment are very expensive. A lot of our Medicare patients are faced with those dilemmas and that they can't pay for their medication because their insurance doesn't allow for medication coverage.
You know what? You've been a savior this year. Thank you.